2, 3.
After you've finished your massage session, it is now time to start your physiotherapy. The best position for the start of the physiotherapy is with the patient lying on his or her side. If your pet will not readily oblige, then all the exercises can be performed with the patient standing, but remember that if hind limb weakness is the problem, the patient will tire much sooner if they are standing for all of the exercises. Beginning with the hind limbs, flex and extend one limb at a time throughout its normal range of movement. Remember to not force the limb at any time. As you flex and extend the limb, it will become more supple and a greater range of motion may well be obtained. With one hand on the hip and the other below the hock, gently stretch the hind limb towards the ear, then as far back as the patient will allow. Extend the limb down away from the body, then flex upwards into the body. Grasping the leg just above the hock with one hand and just below the hock with the other hand, flex and extend the hock joint. Once these exercises have been performed 4 to 5 times, the limb can then be moved in a cycling motion forwards and backwards. Once these exercises have been repeated on both hind limbs 4 to 5 times, then repeat the process on the forelimbs if necessary. Then, place the patient into a standing position, ensuring all 4 feet are placed flat to the floor. Then, supporting the patient under the abdomen, just in front of the hind limbs, gently bounce up and down 10 times. Next, progress to rocking forwards and backwards 10 times. And then from side to side 10 times, and always try and check that the feet are correctly placed flat to the floor. Once you have done this, lift one hind limb off the floor for 5 seconds, and then repeat with the other hind limb. Repeat this exercise 4 to 5 times, remembering to support the patient at all times under the abdomen. This next exercise will probably require 2 pairs of hands. With one person being in control of the front end, the second person is required to kneel on the floor behind the patient and grasp the ankles of each hind limb. The idea is now to walk the patient across the floor for 5 to 10 strides, or more if the patient is doing very well and not seeming to tire. Finally, don't forget to massage and move the tail through its full range of movement. For some points to remember, different animals tire at different rates, and physiotherapy is tiring for recovering patients. Try not to overdo the physiotherapy. If your patient is becoming tired, allow them to rest for a while before starting again. Try to do at least 4 sessions daily. The more sessions you can manage, the more benefit to your pet. If the physiotherapy exercises are tiring your patient out quickly, then use more massage and less physiotherapy until the patient's stamina increases. And always remember, do not force limbs to move further than they are willing, as hurting your patient will cause them to tense up and do all of your work preparing the animal for physiotherapy with the massage.